Hair transplantation can be a life-changing event, but for younger patients it can also become one of the biggest long-term mistakes if performed incorrectly. Why is this? Because a hair transplant, let's say at the age of 24, 25, can become a major problem at the age of 35, 40. And the reality is many patients are making permanent surgical decisions because they're pressured by social media influences, and this is long before their hair loss pattern has even fully declared itself. Today I would like to discuss why younger patients need to be extremely careful before rushing into having a procedure. My name is Dr. Flaviu-Sebastian. I'm a hair transplant specialist, surgeon, board certified plastic surgeon, and I'm based in Harley Street in London. My area of interest particularly are repair cases now and corrective procedures, and I tend to see a lot more in, let's say, the last 2 to 3 years. One of the most important parts of my work is simply not performing the procedure, but it's also counseling and protecting patients from decisions that may look attractive today, but will age poorly over time. So social media has normalized very aggressive hairlines that I've started seeing extremely high graft numbers, these mega sessions, and fast transformations. But hair restoration is not about how a result will look 6 months, 12 months, 18 months after the surgery during the maturation phase. It is about how that result will look in 10, 15, 20 years time, and how it will age in a natural form with the patient's facial features. The first issue younger patients often underestimate is progressive hair loss. At the age of 22, 25, 26-year-old, many patients are still quite actively and heavily losing their hair. Now here where the problem is. A transplanted hairline does not stop future native hair from thinning behind it, or even in the area between the hair. So what can happen is this. Patient comes in, has a consultation, decides to go for having a procedure, and receives a very dense, low-placed, aggressive hairline, let's say in their 20s. Now, over the next decade, the surrounding native hair progressively continues to thin. Suddenly, the patient is left with an isolated island of transplanted hair, poor density behind it, a pattern that no longer looks natural and age-appropriate. And I find that this is one of the biggest long-term mistakes performed in hair restoration surgery, and also one of the hardest to correct. A hairline should not only suit your face today, it should look believable many years later. And this needs to be properly explained, properly addressed, and considered during consultation and when undergoing a procedure. There is also the problem of donor area limitations. And this is what I found the second issue, and quite an important one, being donor exhaustion. Many patients do not realize that their donor area is finite. You do not have unlimited number of grafts to play around with throughout a lifetime. So every extraction, every procedure planned matters a great deal. And unfortunately, younger patients are often pushed towards very large procedures too early in their life, trying to fix multiple areas all at once. And the danger is that if hair loss progresses aggressively later in life, then the patient may no longer have enough donor reserve to correct future thinning. Now, this is why ethical donor area management becomes so critical. And in my opinion, a good hair restoration procedure is often about restraint rather than hairline placement, and certainly not these mega sessions. It's not simply about chasing graph numbers, but having a proper plan in place and respecting it. The next part would be about medication realities. Another conversation that's been avoided, and from what patients tell me it hasn't been discussed properly, is medication. A large percentage of younger patients will require long-term medical stabilization to maintain the surrounding native hair. And that may very well involve treatments, long-term treatments such as finasteride and minoxidil. But medication comes with the reality of a long-term commitment, of the possible side effects, compliance challenges, and also the varying effectiveness between each individual. This is important to consider because surgery alone will not stop ongoing hair loss, and it will not fix the problem permanently when performed at a young age. Reality is that a hair transplant procedure done without stabilization in the wrong patient can create a major imbalance later in life. Another complicated aspect is the social media and the emotional decision making when deciding on a procedure. So therefore, I think it's important that we discuss the social media pressure. Many younger patients compare themselves constantly online and compare themselves with celebrity hairlines, celebrity hair transplants, images that have been filtered, Photoshop, done in perfect lighting, use of fibers, styling products, individuals who had multiple procedures, who have been on medication, of course, image editing, and a lot of other tricks that are nowadays possible, and that probably weren't possible, I would say, when I first started hair transplant more than 12 years ago, and social media was not so popular. What people see online, I find that it's rarely the full reality. This is valid for Instagram, for Facebook, for TikTok, YouTube, and all sorts of media platforms. But unfortunately, emotional decision making can push patients towards surgeries that they might not yet be ready for. This is why I often tell patients hair transplantation should never be performed out of fear or from panic. It should be performed from proper planning. Here's where an ethical surgery and consultation will be important. This ethical consultation should always involve proper discussion about future hair loss, long-term donor area preservation, realistic patient expectations, medical therapy, family history of hair loss, which might or may not be respected in each individual case, and an appropriate, very importantly, age-appropriate hairline design. Sometimes the correct decision is waiting, and this might not be what the patients would want to hear. But waiting can actually be the most responsible medical advice, because protecting the future is even more important than creating an aggressive short-term result for the immediate benefit. The best hair transplant, I believe, are not the ones that look dramatic immediately after surgery. The best procedures I find that are the ones that still look natural many years later. Hairlines can be drawn in minutes, that's not a question, but they will live on the face of that individual patient for decades and throughout one's lifetime. So particularly in younger patients, long-term planning matters more than ever. Thank you very much for watching. If you enjoy my educational discussions around the topic of hair restoration, considering ethical surgery, donor management, long-term planning, feel free to subscribe and follow for future videos. I will have upcoming series on the Instagram as well, but on my YouTube channel as well. Keep following, and remember that great hair restoration is not about creating the lowest, the straightest hairline. It's about creating the most sustainable and long-term one.